Welcome to Study for Nursing, our exploration of the nervous system. In this stack of flashcards, we'll delve into the intricate network that controls and communicates information throughout the body. 1. Information is being carried into a client's neuron from other neurons. What component of the neurologic system will perform this function? The answer is dendrites. Dendrites carry information to the nerve and axons. They also carry information from a nerve to be transmitted to effector cells, which are found in muscles, glands, or another nerve. The soma refers to the cell body. The nucleus is the central part of a cell, which is responsible for the cell's growth, reproduction, and metabolism. 2. A client has experienced a seizure, a deficiency in what neurotransmitter may have caused the client's seizure activity? The answer is gamma-aminobutyric acid, or GABA, which is found in the brain and inhibits nerve activity. It is important in preventing overexcitability or stimulation such as seizure activity. Acetylcholine communicates between nerves and muscles. Dopamine is involved in the coordination of impulses and responses, both motor and intellectual. Serotonin is found in the limbic system and is important in arousal and sleep, as well as in preventing depression and promoting motivation. 4. The nurse is caring for a client who has an injured hindbrain. When assessing the client, the nurse should anticipate abnormal findings in what domain? The answer is basic vital functions. The hindbrain contains centers that control basic vital functions such as blood pressure, respirations, and vomiting. 5. A client has experienced a stroke affecting the right side of their brain. What assessment finding is most likely attributable to this health problem? Is it A, inability to recall the name of a best friend, B, inability to state their telephone number, C, inability to distinguish a spoon from a fork, or D, inability to recall how to apply makeup? The answer is C. The right side of the brain is the artistic side and is concerned with forms and shapes. This client could have difficulty distinguishing the roundness of the spoon with the straight line of the top of the fork. The left side of the brain is more analytical and is concerned with names, numbers, and processes. 6. The nurse is caring for a client with meningitis who is not responding to the prescribed antibiotic and whose condition continues to deteriorate. The nurse should provide which rationale to explain why the client is not responding? The answer is that the blood-brain barrier works to keep large molecules out of the brain and away from the nerves. Most antibiotics are protein-bound and cannot pass through the blood-brain barrier. When the infection becomes severe, the blood-brain barrier will stop being effective and the antibiotics can pass into the brain. The brain has a unique blood supply to protect the neurons from lack of oxygen and glucose. After the blood-brain barrier allows the antibiotic to pass through, the circle of Willis distributes the blood to the areas of need. If someone has an occluded carotid artery, which could build pressure up in the area, the circle of Willis can redirect the blood supply and provide a full blood supply to the affected areas. 7. A nurse is caring for a client who is having adverse effects from long-term antipsychotic treatment. The client is experiencing tremors, shuffles when walking, and is having difficulty sitting up in bed. What disruption to the neurologic system should the nurse suspect? The answer is an interference with the extrapyramidal system. The extrapyramidal system coordinates unconscious motor activity that regulates control of position and posture. caring for a client whose unpredictable emotions are due to an infarct in the limbic system. What hormones are considered relevant to this impairment? Select all that apply. A. Epinephrine. B. Serotonin. C. Gamma-aminobutyric acid. D. Norepinephrine. E. Dopamine. F. Acetylcholine. The answers are A, B, and D, epinephrine, serotonin, norepinephrine. The limbic system contains high levels of epinephrine, norepinephrine, and serotonin. Dopamine, acetylcholine, and gamma-aminobutyric acid are found in the brain, but not primarily in the limbic system. Sustained damage to their limbic system. A. A client who requires mechanical ventilation following a head injury. B. A client whose gait is unbalanced and who frequently falls. C. A client whose moods are described as volatile and unpredictable. D. A client whose sense of smell no longer exists. The answer is C. A client whose moods are described as volatile and unpredictable. The limbic system is responsible for the expression of emotions. The limbic system does not regulate balance, special senses, or respiration. 13. The nurse is caring for a client who's believed to be greatly deficient in serotonin. What assessment is a nursing priority? Is it A. Vital signs, B. Assessment of falls risk, C. Assessment for suicide risk, or D. Deep tendon reflexes? The answer is C. Assessment for suicide risk. Serotonin prevents depression. Restoration of serotonin levels is a cornerstone of depression therapy, and low levels could constitute a suicide risk. This deficiency would not cause disruptions in balance, vital signs, or reflexes. 14. Clients' muscle weakness has been found to result from a lack of neurotransmitter communication between nerves and muscles. What neurotransmitter is most likely deficient? Is it A. Acetylcholine, B. Dopamine, C. Gamma-aminobutyric acid, GABA, or D. Serotonin? The answer is A. Acetylcholine. Acetylcholine communicates between nerves and muscles. Dopamine is involved in the coordination of impulses and responses, both motor and intellectual. GABA inhibits nerve activity. Serotonin is important in arousal.